and welcome into To Your Health. And today we're going to be talking about a very sensitive issue, and it's breast cancer and of course breast surgery. You might want to know, well, Virginia, why aren't you opening this up rather than Jack? Well, guess what? It can happen to a man as easily as it can happen to a woman. Problems with breast cancer. So today we're going to learn a little bit more, and we're very fortunate to have a new surgeon in our area, Dr. Kertrisa McWhite, a graduate of Yale University, but from Albany, Georgia, not Albany, New York.
No.
Nope, you're down in the good part of the world, huh?
Yes.
And we want to welcome you to Montgomery. We're so happy
Thank
to have
you
you here. And you know, last week you were here with us and gave us some good tips as to examining yourself. Now we want to find out, once that happens, what's the next steps?
Okay, so if you feel a breast mass or note some of the other signs, skin changes, bloody nipple discharge, call your primary care physician immediately. You want them to examine you and confirm whether there's even anything to worry about. Maybe it's nothing to do with breast cancer. Maybe it's just a simple fluid-filled cyst. So that's where you start. And then if necessary, you would be referred for a consultation with myself and or imaging.
And you actually are a breast surgeon.
Correct.
So you would be the next step. So
Right.
let's say that I go to my primary care physician and we find something. I have my mammogram
Right.
and we find something. Then I could come and see you. You're with Baptist.
That's right, Baptist and UAB.
And UAB, and just wonderful.
Great
I
combination.
have a very dear friend who has gone through a little of something like this, and she just is, like you said, the cure rate is just amazing. So there's no reason to sit there and be afraid and not go take care of yourself out of sheer fear. You want to stay alive, and this
Right.
is something that can be worked with.
That's right.
So let's assume that I do have something. What would happen there where you felt it was necessary to, do you test first? Do you go ahead and operate? How does that work?
So it depends a bit on the presentation, so it's on a case-by-case basis. But for example, if a patient presented with a small lesion, one that we thought had really good features to it, we might begin with surgery, and then the patient would likely see both a medical oncologist who would talk to you about anti-hormone therapy and or chemotherapy, and frequently we involve a radiation oncologist as well to talk about radiation therapy.
What is, again, I think that this is amazing. The cure rate for this is tremendous. You were saying
Right.
approximately.
So many patients are diagnosed early enough that we
Yes.
find non-invasive cancer, DCIS, and that cure rate should be 100%. For patients who present with an early stage, like a stage 1 breast cancer, small with no lymph node involvement, greater than 95% cure rate.
Okay, and I have another question. This is a very dear friend of ours, and she went, had all this done. She also, I think, had the, I know she had the radiation.
Right.
And I think has been amazed at the fact that you can carry on your life. I mean, this is not as much to be afraid of as people think.
Absolutely. You
So-
know, once a patient receives a diagnosis, you know, I sit down with them and we discuss all of their treatment options. And many times, you know, when I say, you know, 2 months from now or 3 months from now, you're going to be surprised at how quickly this flew by and be getting back to your regular life, your work, your children, all of your fun activities as well. I mean, the fear of it is greater than living
Then
through
what
it.
happens with it?
That's exactly right.
I just think that is a primary message that we would like to get out.
Right, right.
Because I think when you function from fear, you're really playing with fire. And there are so many cancers, Dr. McWhite, where you don't have to die anymore.
Exactly
the word
right.
cancer used to mean that's it. That is so not true.
Well, early on you were saying, and the key word that came out is called early.
Yes.
I mean, early, in anything, no matter what it is on your body, if something seems like it's unnormal,
Right.
and you know, you're the baseline for your own self.
Exactly
Basically,
right.
you should know pretty much what's going on in your life. The other thing is your regular doctor. They have a baseline on you also. So when something's going to happen, don't delay. make that appointment with your doctor. Get in there.
Absolutely right. Absolutely right. You know, I tell patients all the time that no one will know you're normal better than you.
Yes.
Not your
Great
primary
line.
care doctor who sees
Great
you
line.
maybe every
Absolutely.
3 months, not me who will see you, you know, maybe 4 times a year when we're treating breast cancer. You're going to know it best. And if you feel like something's wrong, keep speaking up until we address all of your concerns.
That's right.
Well, one more time, how often should all of us out there have a mammogram?
So certainly by the age of 45, if you are at normal risk for breast cancer, you need to obtain a mammogram every year. If you have a family history, a personal history of breast cancer, ovarian, colon, or pancreatic cancer, that might need to be 10 years earlier. So that's why you have that ongoing conversation with your primary care doctor to determine your specific level of risk and how often you need to screen.
Well, we cannot thank you enough, and
Absolutely.
personally for me and for all the men and women
Yes.
out there, we are so thankful to have you with Baptist and UAB and to have someone so well trained. And if something
you.
does happen, I will be seeing you, and I will not be afraid to see Dr. McWhite. And thank you so much for being with us, and we'll be right back.